So hi everyone, my name is Ased Ali, Medical Director for Convatec. I'm also a consultant urologist, worked in the NHS for about 22 years. So a big part of my work has been fixing bladders and dealing with things like incontinence, frequency and urgency. Usually when I mention that sort of thing, people start suddenly becoming more aware of their bladder. So if you do feel the need to go, yes. The topic that I want to talk about today is links in very nicely with what Andrew was talking about, is how industry can collaborate with the NHS to transform various pathways and improve both patient care, but also give better value for money, and in our case also reduce waiting lists times and numbers. But before I go into all of that, I'd like to start by introducing Convatec. So some of you may know us and others may not, but we've been in the sort of chronic healthcare space for a long time, and we've been around since 1978. We were originally a sort of subsidiary of Bristol Myers Squibb, which is that very large pharmaceutical company. And actually, until relatively recently, we still even kept a residual part of their logo, which you can see in the blue logo. But we, around 2008, we became a separate entity, and we started off in the ostomy space, then moved into wound care, infusion, and continence cares. And next video will just give you a little bit of a taste of our history before I go on to sort of things that we're doing. So that gives you a bit of a summary of what we as a company are about. And as you can see from that, chronic healthcare has always been our area of interest and the area that we've developed products around. Combined with this vision of pioneering these trusted medical solutions to improve the lives we touch, and as the video showed, we've 10,000 colleagues and we're in about 100 countries. The key thing is we spend about 100 million a year in R&D, and the key that I wish to talk about today is about how innovation can help drive changes within the NHS, and how we can help with the long-term plan with various innovative products. I'm going to talk about that specifically in relation to new bladder technology, bladder management technology. But before I do that, just talking about, linking back to what Andrew was talking about, there are some traditional products as well that we talk about. There's been a lot of talk about things like digital and all sorts of new sophisticated areas that I think everyone sees in the future. But there are also sort of more standard products, things like dressings. And before we go on to some of our more sort of electronic technology, I want to just talk about something a bit more traditional, and that's Dan's story. So Dan's actually works in our R&D team in Deeside in North Wales, and he actually went out walking one day in the countryside on a summer's day, and came back with a small, presumably some sort of tick bite on his leg. 3 days later, he started to feel quite ill, and you could probably just make out on that thing. It started to get cellulitis, a skin infection around there, and he ended up getting admitted to hospital. In hospital, he was then treated with intravenous antibiotics, and that helped get on top of his sort of systemic symptoms. But in the meantime, the area around the skin of his wound got pretty bad, and it was dressed at home by community nursing team using some standard dressings. By about day 18, you can see what that looks like. It was pretty horrendous. He then got admitted to hospital, and the consultant orthopaedic surgeon saw it there and said, well, look, that's going to all need to be debrided, and it's going to have to be excised and grafted. And he was marked up and all ready to go. Dan, however, sort of begged a colleague who's also a Convatec nurse that, look, can you please dress this with Aquacel AG Plus Extra, which is one of our top-selling products, and contains silver as an antimicrobial and other technology, and did that literally the following day. The orthopaedic surgeon who'd listed them for surgery for the following day came and reviewed the wound and said, oh, this is looking a little bit better. Maybe we'll delay the surgery by 24 hours and let's see if this carries on. And they did, and they delayed it by 24 hours, and it got a bit better. And as you can see, by day 22, that was only 3 days after they started doing that, the wound has largely, and that was just by changing the dressing. Now, wound care is a massive segment of the health service. Spend is about 8 billion, second only to cancer and diabetes. Standard dressing, 10 by 10, costs about 2 to 3 quid. Aquacel colloid dressing maybe would cost about 4 or 5 quid. Aquacel AG Plus costs 6 quid. That's the difference that a £6 dressing makes compared to a £2 to £3 dressing in over so days. And I think this illustrates really nicely how technology, the right innovation, used the right, can save you a ton. I mean, can you imagine the cost of a skin grafting, how many days you would have to spend in hospital? It also makes you wonder, if you'd only have had the right dressing, would you ever have got to day 18 with that mess from what started as that? I think that's it. And that's a very basic sort of technology. It's just a wound dressing. But this is the sort of thing that, I think this is the kind of things that the NHS looks to think about in terms of when we talk about innovation. And it's on that line that, so again, that, our aim is to be a sort of trusted partner delivering value to the NHS. And our sort of proposition for medtech in relation to sort of bladder management is sort of come with treatments that control symptoms, treat without delays, offer viable options, not having patients reliant on pads or catheters, socially engaged, continuing with work, and including in their shared care decisions, and essentially living the best their best life. And it's with a view to that I'd like to talk to you about, one of the new technologies that we hope to bring, and we're collaborating with a company called Blue Wind that's already launched the product in the US, and it's called Revi. And this is a system that's used to manage overactive bladder. And overactive bladder is quite a common, because again, this is the point where people might start to feel a little bit aware of their bladder. And the standard symptoms that people get are frequency, urgency, and it's that sort of, can't quite make it. We have to rush to the toilet, often will make it, sometimes won't. We get these. And about 4.5 million UK adults are some of this. And it is associated with aging, so it does get more common as you get older. And about 100,000 or so of those will be on some form of pharmacotherapy, but guess what? Around 80% discontinue drugs within about 6 months. We don't really know what the ultimate underlying cause of overactive bladder is. Most people, it seems to be what's called idiopathic. You do sometimes have neurological causes and other sorts of systemic type causes, but most common type is idiopathic bladder, overactive bladder. And control strategies are normally the first line of treatment is sort of control strategies, bladder training, progressively trying to hold on longer, controlling your fluid intake. And then, as I mentioned, medication can be used, but there's quite a bit of side effects. There's even a little bit of fear of that there might be some influence on dementia as well, because one of the class of drugs is what's called the anticholinergics. And then beyond that, you're on to sort of what we call third-line treatments, which can include things like intravesical Botox, which means Botox injections into the bladder. So that's the same sort of stuff that we put in their face for use for cosmetics, but it's put into the bladder through a little telescope. And this works actually quite well, but it has to be done every 6 months. So it's literally, once you've started that treatment, every 6 months, got to come in, have a telescope. It takes about 10-15 minutes, telescope put in the bladder and injected, and then it works for a while and wears off. Sometimes it can work too well, and if it does, then you might not be able to pee at all, in which case you have to catheterize. So there are some problems with that existing treatment. The other alternative is something called sacral neuromodulation, which involves stimulating the nerves as they come out of your back and control the bladder. That's a two-step procedure done typically under spinal or general anesthesia. You do require special expertise to do that, to be able to feed the wire in. It's done under X-ray guidance, and the first procedure is like a test procedure. It takes about 10-15 minutes to do that, and operation probably takes in total about half an hour. And then if that works, you then have a second procedure with a full implant, which can take about an hour and a quarter. If all of that fails, then you've got the option of things like a long-term catheter or managing with pads. And so, in summary, these are the sort of existing sort of treatments. And as I say, they've each got their own issues. Massive market for diapers and pads now. I think there's about 350 million spent on that. Some of that is spent privately. People buy their own. Some of that is spent NHS, by the NHS. There are limits on how much the NHS is. So a lot of regions will only allow you to have 8 pads maximum a day, whether that's enough or not. There can be other restrictions. As I mentioned, pharmacotherapy. Different types of neuromodulation, one of which I already mentioned. The other one is tibial nerve modulation. That involves you having to come to hospital every week and have something put into your leg, stimulate for half an hour. But can you imagine that, having to come every week to hospital for a period of sort of 8 to 12 weeks and have a procedure done? Similar sort of thing with Botox, coming every 6 months. So clearly there's a big need here in terms of what the current offering is. So it's with that we will collaborating with a company called Blue Wind to bring in a different form of management, which again involves sort of controlling the nerves that pass the bladder, and the nerves that go down the leg actually feed back and connect to the same nerve roots that the sacral nerve does, that was involved in that sacral nerve modulation. And what Revi is a tiny little implant. Is about the size of a fuse in a plug, a little bit, maybe a tiny bit longer. It's got a couple of wings so it can be stitched in. Is implanted on this tibial nerve. That procedure can be done under local anaesthesia. Takes less than 30 minutes to do. Once that's done, that's it. It doesn't need anything else done. On top of that, you then have a wearable that you wear for typically twice a day for 30 minutes. You could wear it when you're having your breakfast or when you're having dinner or just watching the telly at night. Can be less than that, can be more if the patient, but totally patient controlled with a wearable, programmed with a tablet by the clinician. And also it has an optional hub which can communicate again with a clinical system to let clinicians know how much it's being used, whether it's working or not. So combining a lot of the sort of things that we were talking about, both monitoring, an easy to insert implant under local anaesthesia, and that's also MRI compatible. And we also know that from our clinical studies where we've when we looked at this, that actually the results of this are comparable to sacral neuromodulation, which I said involves this quite substantial operation where you've got to come in twice and have something done in the operating theatre. It's also comparable to intravesical Botox, for which you have to keep coming every 6 months or so to be re-injected. So efficacy is around 82%. Patients had a 50% reduction in symptoms, which is the typical measure that's used. 95% patient satisfaction, and 50% of patients were dry on 3 consecutive days. No significant adverse events. Now, you can imagine what difference a treatment like that could make to those existing treatments. So you've got one where you literally forevermore got to keep having someone coming in every 6 months. You've got another one where sacral neuromodulation, where 2 operating theatre visits. It also has amongst the longest waiting time of any urological procedure. Waiting times extending from 12 to 18 months. Where something like this could be done under local anaesthetic without an operating theatre. So that's the sort of thing that we are suggesting where innovation really can change the pathway. So quick one-step implants, reduced resource needs. You no longer need an operating theatre. You don't need a scrub team. You don't need a radiographer to do x-rays. You don't need an anaesthetist. And because the wearable is on the outside, you don't have an internal battery, so you don't ever need to have another operation again to replace the battery. So as well as being significantly efficient, you also have massively reduced costs. It's about a 50% lower procedure cost because you don't need that operating theatre anymore. You don't need all of that additional staff. And you can imagine what that could potentially do for waiting times for this condition where people are waiting up to 18 months. It went as high as 2 years during the COVID period because it was a benign procedure, doesn't get prioritised, so people are just left to manage with their incontinence. So at the moment, what we're doing is we're aiming to validate the cost effectiveness of this. We've commissioned YHEC, the York Health Economic Consortium, to do a health economic model to show how this can be cheaper. We're engaging with various integrated care systems to try and see how we can bring this into NHS hospitals, particularly in places where they've got long waiting lists for neuromodulation. We'll be starting with a value-based procurement study to try and demonstrate that for real. So we've got it in theory, show it in real, and then with a view to eventually making this available. That's not the only thing. So I've given you one case, well, 2. We talked about something that was already there, Aquacell AG Plus Extra. We talked about something that's in the pipeline in terms of Revi. It's a whole bunch of other innovations that at Convatec we're looking to build out. And all of these, the common aim is that doesn't have to be a choice in patients between great care and cost. You can actually have the two together. You can actually do things that are better for the patient, but are also cheaper for the health service, or at least provide better value for the health service. So just to conclude and tie in back to the sort of NHS plan. These are the sort of things we're given one good example of how we can reduce long waiting lists for elective surgery. Talk about embracing innovation, adoption of new technologies, working with integrated care systems to try and do that and align with the medtech strategy. Driving efficiency and savings. Estimated saving of £2,000 per procedure at the outset. That's not even taking into account what the long-term saving is by doing this. This is on at the time of the procedure, i.e. on whatever you want to call it, day 0, day 1, £2,000 saving per procedure and reduction in the NHS resources required. I mean, getting 2 theatre lists synchronising one after the other is no mean task. But most of all, it promotes patient mental well-being. This is a patient-activated device, fits in with their lifestyle, and helps cure what is actually a really significant problem. Can be very disabling to have urge incontinence and to have to always be aware where toilets are and having to be worrying about your bladder. That's all from me. Thank you very much.